Good day everyone. First of all, I would like to sincerely thank for the ISDFS 2026 organizing committee for giving us this opportunity to present our research at this symposium. So I am Samdi Jaivikrama, and on behalf of my other authors from the Sri Lanka Institute of Information Technology, I am pleased to present our work title An Interpretable Multimodal AI Framework for Severity Aware and Guideline Aligned Treatment Recommendation in Chronic Spontaneous Urticaria. So, in this presentation, I will briefly cover four main aspects of our work. First, the clinical motivation behind the problem. Second, the research gap in existing AI-based dermatology systems. Third, our proposed multimodal AI framework. And finally, the experimental results and clinical implications of the proposed system. So let us begin by looking at the clinical problem. Chronic spontaneous urticaria. It's commonly referred to as CSU, is a dermatological condition that characterized by recurrent itchy weeks or hives that persist for more than 6 weeks. Although it is not usually life-threatening, the condition can significantly affect patients' life, the quality of life, including the sleep, daily activities, and psychological well-being. One of the major challenges in managing CSU is disease severity always varies in patient to patient. So clinicians often need to consider several types of medical information before making treatment decisions. So when we get an example, they analyze skin lesions images, and after that, if further wants, they have to evaluate the laboratory biomarkers, and they review clinical descriptions that narrates the patient history and how the symptoms are going on. However, so integrating all these heterogeneous clinical signals into consistent decisions can be quite complex. As a result, clinical decisions making may depend heavily on the relevant clinician physician experience. So this motivates the need for intelligent clinical decision support system that can combine multiple types of medical evidence. So currently, although there are so many AI has been increasingly applied in dermatology, many existing based systems focus primarily on image-based lesion classification. In other words, they analyze the skin images and always ignore the other important clinical information such as lab biomarkers or patient symptom description. Another limitation that we have observed is many models rely on static fusions or unimodal pipelines, meaning they cannot dynamically adjust the contribution of different data sources. Furthermore, most existing systems do not incorporate clinical treatment guideline logic, which is more essential part in current medical decision support systems. And finally, the uncertainty handling and safety mechanisms are often missing. So we have illustrated that in this table to get a very clear picture. So, to address those previously discussed gaps, we propose an interpretable multimodal clinical decision support framework for chronic spontaneous urticaria. The core idea of our approach is to integrate these three complementary sources of clinical information. So first, dermatological images of skin, second, structured laboratory biomarker values, and third, clinical text narratives that describe patient symptoms and medical history. So by combining all those data sources, system can produce more comprehensive prediction rather than the unimodal versions. So in this, there are two main components. The one is risk severity side effect prediction framework, and the other one recommend the guideline aligned drug classes for CSU treatment. So this slide illustrates the overall architecture of the proposed multimodal framework. The system begins by, as you can see, the system begins by processing three different types of inputs. The first modality consists of dermatological images, which are processed using visual encoder to extract the visual features related to the skin lesions. The second modality includes laboratory biomarkers, which are encoded using multi-layer perceptron neural network to capture the relationships among clinical variables. And the third modality, as you can see, consists of the clinical narratives, which are processed using transformer-based language model to capture contextual information about patient symptoms. After extracting modality-specific features for each modalities, these representations are combined through a gated multimodal fusion mechanism. So this gating mechanism allows the model to learn how much each modality should contribute to each different prediction task. So in this, the fused representation is then passed into the several task-specific prediction heads. Then these outputs module generate predictions, several predictions, as you can see as output heads. So there are disease severity classifications, side effect risk estimations, drug class recommendation, and treatment escalation guideline. In the latter part, there is an interpretability layer there. So this is not a mere prediction or output giving from our system. This part gives how those predictions and how those decisions have been made, and with the clear picture to the clinician and relevant consultants. And the methodology. So previously described, there are two main components: risk severity side effect module and prescription recommendation module. So in this risk module, it mainly focuses on laboratory features and clinical text features that are encoded separately and then integrated using the gated fusion mechanism. The gating network then dynamically determines which modality is most informative for each prediction task. And then the second component is the prescription recommendation. So in this, model integrate the image, lab biomarkers and clinical text features, then recommend drug classes that align with established CSU treatment guidelines. To improve clinical reliability, we introduce the guideline consistency constraints. So as safety mechanisms I have mentioned there, which so from those it discourages medically impossible predictions. Additionally, the framework includes so to support those, additionally the framework includes the confident calibration and OOD, out of distribution detection, and to allow the system to identify the uncertain cases and defer them when clinician review when necessary. So, to evaluate the effectiveness of the proposed framework, we construct multimodal data set. So, there should be a recreation step there. So, approximately our data set has 3,000 patient level chronic urticaria records. Each record contains a dermatological lesion image, laboratory biomarker value, and a clinical narrative describing their each symptoms. The treatment labels correspond to several drug classes commonly used in CSU management. For evaluation, we perform patient-level data split using 70% of the data for training, 15% for validation, and 15% for testing. So all the models were implemented using the PyTorch deep learning framework and trained using the standard optimization settings, as you can see in this slide. So now let's look at the experimental results. To evaluate the effectiveness of our framework, we compared the proposed multimodal with several baseline approaches, so including unimodal and static fusion models. First, image-only baseline model achieved approximately 68% accuracy. For drug class prediction, when we applied static multimodal fusion, which combined the multiple modalities in a fixed way, the performance improved in around 78.5%. However, our proposed gated multimodal fusion model achieved the best performance, reaching 82.3% accuracy for drug class prediction. Similarly, for risk and severity prediction, the proposed framework achieved 84.6% accuracy. So those improvements highlight an important observation: by combining dermatological images, laboratory biomarkers, and clinical narratives can capture richer clinical context compared to unimodal approaches. And the another important aspect, as previously I have said, the medical AI system is interpretability and clinical safety. So to improve transparency, we apply GradCam visualization techniques which highlight the specific regions of the skin image that influence the model predictions. This allows clinicians to visually verify whether the model is focusing on medically relevant areas or irrelevant areas. We also analyze the contribution of different modalities across prediction tasks. For example, in this table you can see how lab biomarkers, clinical narratives often contribute strongly to severity prediction, while visual features from skin images play a large role in treatment recommendation tasks. To conclude, we present an interpretable multimodal AI framework for chronic spontaneous urticaria adhesion support. So, main finding, drug class, clinical risk and side effect with a very good accuracy, and our experimental results shows that this is a very good clinical safety rather than the unimodal approaches in existing system. So in future work, we plan to extend this framework in large multi-center clinical datasets, further collaborate with clinicians for real-world deployment. Finally, I would like to once again thank for the ISDFS 2026 Organizing Committee and the audience for their time and their attention. Thank you so much.